Thinking about switching from Trulicity to Ozempic, or maybe even Mounjaro, you are definitely not alone. Whether it is because of side effects, insurance changes, or your doctor recommends something stronger, switching is more common than you think. And the good news is, it is totally doable when you do it the right way. In this video, I will walk you through exactly how to switch safely, what to expect during that transition, and how the doses compare so you are not caught off guard. I am a licensed pharmacist, and this is Pharmacist Online. In our last video, we talked about the pros and risks of staying on Ozempic long-term. But today, let us look at what happens if you are moving over from Trulicity. Let us start with Ozempic. Both Trulicity and Ozempic are in the same class of medications. They are called GLP-1 receptor agonists. That means they work similarly by helping lower blood sugar, reducing appetite, and supporting weight loss. But they are not the same drug. Trulicity contains dulaglutide, Ozempic contains semaglutide. And in head-to-head studies, Ozempic often came out ahead when it came to A1C reduction and weight loss. So how do you switch from Trulicity to Ozempic? Most doctors will stop Trulicity, then start you on Ozempic on your next scheduled injection day. There is no overlap, and you do not need to taper off. Just stop one and start the other. Now, let us talk dosing, because this part is key. Trulicity comes in 4 dose options: 0.75, 1.5, 3, and 4.5 milligrams once a week. Ozempic has its own dosing path. You always start with 0.25 milligrams for the first 4 weeks, no matter what Trulicity dose you were on. This starter dose is not meant to control blood sugar yet. It is just to let your body adjust and reduce the chance of side effects. After 4 weeks, your dose usually increases to 0.5 milligrams. From there, your doctor might increase you to 1 milligram or even 2 milligrams based on how well it is working and how you are feeling. Now, what if you are switching to Mounjaro instead? Mounjaro is also a once-a-week shot, but it is in a different class. It works on both GLP-1 and GIP receptors, which may give it more power for blood sugar control and weight loss. If you are switching from Trulicity to Mounjaro, your doctor will stop Trulicity and start Mounjaro at 2.5 milligrams the following week, even if you are on a higher Trulicity dose. That first dose is just a starter to help minimize side effects. Then, your provider will slowly raise the dose every 4 weeks based on your progress. So, what should you expect during the switch? You might notice side effects come back temporarily, even if you did not have them on Trulicity. Things like nausea, bloating, or fatigue can show up again, especially during that starter phase. You might also see a little delay in blood sugar improvements or weight changes. That is normal. Most people start seeing results again between weeks 8 and 12. And just a reminder, do not make any medication changes without your doctor's guidance. They will help you adjust your dose, monitor for low blood sugar, and make sure the transition is smooth and safe. Let us do a quick recap. Yes, you can switch from Trulicity to Ozempic or Mounjaro. There is no overlap. You just stop one and start the next. You always start low, even if your Trulicity dose was higher. Some side effects might come back temporarily. It may take 1 to 2 months to see steady results again. Have you made the switch from Trulicity? What was it like for you? Drop your experience in the comments. It might help someone else feel more confident about their next step. Next up, we are talking about Ozempic plateaus, what to do when your weight loss or blood sugar progress stalls. If this video helped, tap that like button, leave your questions below, and subscribe to Pharmacist Online for more clear, real-world health info you can actually use. Thanks for watching, and take care of your health.